So today we are talking about dry eyes. I'm Dr. Tushar. I'm the medical director at Vision Eye Center and an associate consultant at Sir Gangaram Hospital in New Delhi. Probably is the most common complaint that we see in our clinics today. So we thought we should discuss that. So what is dry eye? Dry eye is basically an instability of your tear film. Now this can be caused by an inadequate production of tears or a poor quality of tears, and because of this, the tear film, which basically forms the outer coating of your eye, keeps your eye moist, keeps your eye healthy, and also helps with good vision, gets affected, and therefore you suffer all the symptoms that come with dry eye. Dry eye is characterized by symptoms like burning sensation in the eyes, grittiness, a foreign body sensation, discomfort. You also experience a sense of blurring, particularly at certain points of time. Your vision might clear out when you blink a little bit and then gets blurred again. There are certain difficulties with vision at night as well. So these are the common symptoms that you experience with dry eyes. So there are multiple approaches to treating dry eyes. One is to replenish the tear film that has been depleted. This is done using tear supplements, or they're called artificial tear drops. Then it's also important to identify the underlying cause. So if there is an underlying systemic disease which is causing the problem, or there are certain medications that might be causing the problem, you need to find out what it is and try and eliminate those as well. Apart from that, there are factors such as inflammation, which means the reaction developing in the eyes, that are playing an important role. So it is important to give medication to treat that as well. There are drops available such as cyclosporin eye drops that help with that. A course of steroid eye drops also helps in reducing the reaction in the eye and therefore improving the dryness. Then there is also a lot of equipment and instruments that are available now to improve the quality of your tear films. So these include thermal pulsations that are given to your eyes. There are masks available which help improve the functioning of the glands which produce a certain component of tears. So a lot of factors are available. Most common of these, like I mentioned, is the lubricant eye drops. Other than that, important to treat your underlying cause, which brought you into dry eye in the first place. And apart from that, various other factors which are specific to your condition and specific to the problems that you are having. If the tear production is extremely low, sometimes we use a device called punctal plugs, which prevent the drainage of tears from out of your eye. So they prevent the tears from going out of your eye. So those can also be used in certain specific situations. There are also specialized contact lenses available which help retain tears in front of your eye, in front of your cornea, so that your cornea stays moist. So there are various methods available to address dry eye, and a lot depends on what kind of dry eye you have, what is the severity of the condition in your case, and based on that, an approach has to be devised. So if you have severe symptoms of dry eye, it's important to see your eye care practitioner so that your treatment can be planned.